To bring you the latest on the pandemic as it is affecting us nationally, we want to focus on the situation in the Northwest Territories, battling more cases now than it has at any point in the pandemic. And take a look at this map, because this is the one that we return to from time to time. It's so revealing. It shows us the rate of cases. So it is the number of cases per 100,000. And you can see that the highest rate of all the country is in Northwest Territories, a rate about 1.5 times that of Alberta, which is second. Of course, the rate, again, having to do with population size, but that, again, the number of cases per 100,000. And it gives us a reason to talk for a few minutes with Dr. Cami Candola, who is the Chief Public Health Officer for the Northwest Territories, with me from Yellowknife Live this morning. Dr. Candola, welcome to our program. We're glad to have you with us this morning.
Good morning, Heather.
Good morning. So that rate, that map is always concerning to us when we look at it on the program, and equally concerning the record number of cases yesterday, 378. Is that the number you have this morning, or has that changed even further from that 378, which was yesterday?
That number still stands. We update our stats every day. And that's the number we had. That's the latest figures we have to date.
Is that being driven by the Delta variant, Doctor?
So in the Northwest Territories, we are actually experiencing our first wave of what I would call a new Delta pandemic. It's 100% driven by the Delta wave. And we are basically having to go back into some containment measures. The communities that are most impacted are Yellowknife and Baychoco, which is about 100 kilometers away from Yellowknife.
So it's a bit localized. Those numbers are focused in those communities, not all throughout the territory. Can you give me a sense of what might be behind this jump up to 378? Northwest Territories, you did such effective work. You had eliminated virtually from the territories. Now it has sprung right up to these record numbers. What is behind that spread?
So just to validate, Northwest Territories that was at one point had no active cases. So we went from no active cases to a rate of almost 7 times the national average for current active cases. And that started in mid-August, where we had a super spreader event in our community with a large gathering, and that spread to that region and into Yellowknife. What we're seeing now is localized outbreaks in 2 places, which is Yellowknife and Baychoco, and initially was driven by the super spreader event that happened in another region, but it's now taken off in our underhoused population in the nearby community with travel back and forth. We're seeing support staff for the underhoused population also acquiring the virus, and it basically is a very infectious virus. We've had schools closed in both communities for a number of weeks, but it's still we still have not reached the peak of infections both for Yellowknife and Baychoco, and we have containment measures. No more than 25 outdoors.
So it's community spread. It is in the schools too, as we're seeing elsewhere in the country.
No, it's not in the schools.
It's not in the schools. Okay, you just
we had schools closed to avoid school outbreaks.
To avoid, okay, so prevention to avoid it getting into the schools. But, I'm looking at our CBC vaccine tracker, Doctor, has 94.71% of people in your territory having had 1 dose of vaccine, 89.3% having full vaccination. Those are really strong numbers. Are the people who are now reporting COVID diagnoses, are they vaccinated, or are we seeing in Northwest Territory what we're seeing elsewhere in the country, that this is among largely unvaccinated people now?
So what we're seeing is that 70% of our cases and 70% of our severe outcomes, which is hospitalizations and ICU admissions, are still in the non-fully vaccinated. But what you have to understand is in the Northwest Territories, we acquired the vaccine a lot earlier than the rest of Canada. And so we had administered the vaccines in very tight intervals of 4 to 6 weeks, first in our high-risk populations and then the general population. So we're seeing a mixture of mainly driven by non-fully vaccinated, but also waning immunity in our fully vaccinated.
Waning immunity, that's an interesting aspect to this story. What kind of pressure are these numbers placing on your hospitals, your healthcare system?
It's placing a significant pressure. The last 6 weeks alone, we've had 36 hospitalizations. And prior to that, for the whole pandemic, we only had 4 hospitalizations. We had 6 deaths in the last 6 weeks, and we've had 13 total ICU admissions. This is for a small territorial hospital. This is it's a huge system demand. In addition, most of our critically ill patients that need further care are sent to Alberta, and Alberta is also stretched. So the containment orders that we have for Baychoco and the gathering restrictions we have for Yellowknife is still causing a number of hospitalizations, but we're able to keep it under control.
Okay. I will get to the gathering in just a second, but what you've described, those numbers, because we know the limited situation for healthcare and hospitals there in that territory. You mentioned Alberta, Saskatchewan, talking about the crisis in their hospitals. How close are you to a crisis in your measure, by your standards, by what you have? In other words, how bad is it? We have public health measures, so we've had a mandatory mask mandate for a number of months. We have strict gathering orders, but because we have closed schools, we have gathering limits of less than 10 in restaurants or other establishments, and no more than 25 outdoors, and then household only, no visitors to homes. We have full containment in Baychoco. This is the way we can keep a steady trickle of hospital admissions happening, but at a rate that can be sustained. If I were to lift the orders, it would overwhelm the hospital system for sure. Okay, so not at the crisis point yet, thankfully, given the measures that you're taking. But you did mention if you have to send people to Alberta, we know that they can't take anybody else. They're in such dire straits right now. Are you having to send those patients elsewhere, or where are you looking for assistance?
Thankfully, with Alberta, they consider any N.W.T residents as Alberta residents. Okay. And so that decision had to be made. We have a good relationship with Alberta, and they do not treat us any differently than their own residents.
You mentioned the measures that you've already taken in the territory. Are you looking at having to take any additional measures, bring in any further restrictions, do you think?
So there was an additional restriction that we put in a nearby community, which is Baychoco. The 2 communities that have the highest number of cases are Yellowknife and Baychoco, but one of the restrictions in Baychoco was to limit the travel back and forth from Baychoco to Yellowknife, just to avoid further spreading and seeding back and forth. So that was put in place on Monday, and we need to have people follow the containment orders and the gathering restrictions. We'll get through it. I know in that Sartu region where we had initial outbreak, they've recovered. Their vaccine numbers are up, and they're a good example of sticking it through, following the orders, and we'll get through the first wave. And that's what we're hoping to do in the next 2 weeks.
It's good spirit, Dr. Candola. We'll get through it. I was going to ask you that. Here you are. You've taken tough measures. You've been right on top of the vaccination. You had eliminated COVID from the territory, and now it's back with a vengeance. What does it feel like? I mean, how do you feel about this 19 months into this saga of the pandemic and being in the situation you are now?
I think N.W.T has, for this example, has a lot to tell the rest of Canada, is that when you look at Israel, when you look at UK, when you look at the US, you have to factor in, unfortunately, waning immunity 6 to 8 months after people receive the second dose, and be prepared. And so at this point is when I'm looking at what's happening, my main priority is to avoid severe outcomes. So we are looking at booster options for those who are 75 and older. We've already administered 3rd doses to immunocompromised, given boosters to long-term care. But in Yellowknife and Baychoco, we are now administering boosters to those of 75 and older, and giving boosters to our frontline staff.
Listen, you're dealing with a situation, a serious situation, but I listened to you. It's very impressive, the proactive nature of what you're doing. And thank you very much for giving us some time. We need to focus on what's happening in Northwest Territories, and I appreciate your expertise and your time today, Dr. Candola.
You're welcome, Heather. Have a good day.
Thank you. You too.